Today we will discuss about the larynx. This is a specimen of the larynx. This one is a tongue, and here this is a pharyngeal wall. This is a posterior wall of the pharynx. We have cut the posterior wall of the pharynx and we open the laryngopharynx, and this is the continues as a pharynx, and we also open the larynx. Here we have cut the larynx. So this is the specimen of the larynx. So the larynx, it is the organ for production of the voice, or it is also called the organ for the phonations. It is also act as a air passage as well as a sphincter at the inlet of the lower respiratory passage. Larynx, it is a voice box. It is well developed inside the human, and capability of the are greatly enhanced by the large vocalization area inside the lower part of the motor cortex of the cerebrum. Anteriorly, it extends up to the anterior midline of the neck. So the larynx anteriorly it extends up to into the anterior midline. Here you can see this is the anterior midline of the neck, and anteriorly it is from the laryngopharynx at the upper border of the thyroid cartilage, or above to this thyroid cartilage there is on the posterior side of the tongue there is epiglottis, and it extends up to the C3 to the C6 vertebra, and it ends at the up to the cricoid cartilage. Here you can see this is the thyroid gland, and just below to the thyroid gland there is a cricoid cartilage. This is the thyroid cartilage, and this is the cricothyroid muscles. So this one is the cricothyroid muscles. So it extends from the C3 to the C6 vertebra, and laryngeal inlet to the cricoid cartilage. It is the extension of the larynx. Here you can see this is the laryngeal inlet, which is formed by the posteriorly. This is the cartilage. It is called the arachnoid cartilage. This is the cricoid cartilage, and just above to it this is the arachnoid cartilage. This is the arachnoid cartilage. This is the corniculate cartilage, and above to it cuneiform cartilage. So posteriorly the laryngeal inlet, which is extend up to the interarachnoid fold of the mucous membrane between the two arachnoid cartilage. On the each side it is extend up to the arachnoid to the epiglottis. There is a extension. It is called the ariepiglottic fold. It is the ariepiglottic fold, and anteriorly it is the upper end of the epiglottis, which is rounded in shape, and it is this forms the laryngeal inlet. It is the level of the C3 vertebra. The anterior part of the laryngeal inlet, which is the higher level as the posterior part of the laryngeal inlet. The laryngeal inlet, which is end at the lower border of the cricoid cartilage. Here you can see this is the cricoid cartilage. It is the lower border of the cricoid cartilage. It is the end of the larynx. So it is extend from the C3 to C6 vertebra, and the length inside the male, it is the 44 mm in male, 36 mm inside the female. So the length of the larynx inside the male, it is 44 mm to 40 to 45 mm, while inside the female it is 35 to 40 mm length inside the larynx. So this is about the larynx. It is formed by the cartilage, it is formed by the membrane, it is formed by the ligament, and it forms by the extrinsic and intrinsic muscles. Now we will discuss about the cartilage of the larynx. The first cartilage of the larynx, it is a 3 paired and 3 unpaired cartilage. The unpaired cartilage, it is the epiglottis. The another cartilage, it is the anteriorly, it is the thyroid cartilage. This is the thyroid cartilage, and this one is the cricoid cartilage. So the cricoid, thyroid, and epiglottis are the unpaired cartilage, while here you can see this is the cricoid cartilage, and just above to it this is a portion, it is called the arachnoid cartilage. Above to the arachnoid cartilage there is a rounded bean shape, it is a corniculate cartilage, and above to it there is a rod shape, it is a cuneiform cartilage. The corniculate and cuneiform cartilage which is lies inside the aryepiglottic fold. So 3 paired and 3 unpaired cartilage which is lies inside the larynx. The first one is the epiglottis. It is forming the mainly lip shape. The epiglottis, it is a lip shape, lip-like, and extend beyond to the hyoid bones. Here you can see this is the, and it lies behind to the tongue. So above it is behind to the tongue, as well as it is anteriorly, you can see this is the hyoid bone. So it is posterior surface of the hyoid bone, it is the epiglottis which is connected. So it is the lip-like structure. The most lower part of the epiglottis which is attached to the thyroid cartilage into the midline by the thyroepiglottic ligaments. It is by the thyroepiglottic ligament. So here you can see this is a attachment of the lower end of the epiglottis. It is by the thyroepiglottic ligaments. Anteriorly to the hyoid bone, here it is difficult to see, but here it is attached to the hyoid bone by the hyoepiglottic ligaments, and tongue it is attached by the median and lateral glossoepiglottic ligament. This is the lateral glossoepiglottic ligament on each sides, and there is a median glossoepiglottic ligaments, and in between there is a space, it is called the vallecula. It is called the vallecula. The epidermis towards the facing towards the tongue or pharynx, it is lined by the stratified squamous epithelium, and the epiglottis line towards the larynx or respiratory passage, it is the line by the pseudostratified columnar epithelium. So it has a epiglottis on it is attached to the arachnoid cartilage by the aryepiglottic folds. Here you can see this is the aryepiglottic fold on the both the sides, and this aryepiglottic fold which contains the two muscles, one the muscles which is goes from the arachnoid cartilage to the epiglottis, it is called the aryepiglottic muscles. Here inside the quadrate membrane, or it is called the aryepiglottic fold, inside there is a muscles fiber, vertical muscles fiber which is connecting to the arachnoid to the epiglottis. It is the aryepiglottic muscles. Another muscles inside the aryepiglottic, it is the, here you can see just laterally this muscle fan shape, it is the spreading of the muscles fiber. This muscle fiber, it is the this muscle fiber, it is the thyroepiglottic muscles. It is the thyroepiglottic muscles. So the aryepiglottic muscles, which is contraction of these aryepiglottic muscles, it lead to there is a epiglottis which is closed, so the laryngeal inlet which is closed. While the thyroepiglottic muscles contraction, this is the thyroepiglottic muscles, and contraction of these thyroepiglottic muscles, it lead to there is a laryngeal inlet which is opens. So this is the about to the epiglottis. Another cartilage, it is the thyroid cartilage. This is a posterior, these are the two lamina which makes the thyroid cartilage. It is the largest cartilage, it is the unpaired cartilage, and it is the act as a shield to protect the larynx from the front side. And posteriorly it is the incomplete, it has a four border, it has a two lamina. This is the right lamina, and this is the left lamina. Two lamina which is attached on the midline, it is called the anterior border. This is the superior border. Superior border which is convexo-concave. Here it is the convexo-concave, anteriorly it is convex and the posteriorly it is concave, and it is attached to the hyoid bone by the thyroid membrane. This is the thyroid membrane, and this thyroid membrane which is pierced by the internal laryngeal nerve and superior laryngeal artery. Just below to the thyroid muscles, this is the thyroid muscles, and here you can see this is the nerve supplies to the thyroid. It is a branch of the C1, and just reflecting the thyroid, Here you can see this is the hyoid bone and this is the thyroid cartilage, and this is the in between there is a thyroid membrane, and this thyroid membrane, which is pierced by the superior laryngeal artery along with the internal laryngeal nerve. This is the internal laryngeal nerve which is pierced and it is enter inside the larynx. So the thyroid cartilage, it has a two lamina, right lamina and left lamina. It has a four border, superior border, inferior border. This is the inferior border. This is the two posterior border, and this is the anterior borders. It has a outer surface. This is called the outer surface, and when we can see from the inside, this is called the inner surface of the thyroid cartilage. So the upper surface, which is convex, convexo-concave, and it is attached to the hyoid bone by the thyroid membranes. Inferiorly, the inferior border, it is the lower border, it is attached to the cricoid cartilage. It is attached to the cricoid cartilage by the externally there is a cricothyroid muscles. This is the cricothyroid muscle. Externally there is a cricothyroid muscles, and just beneath to these cricothyroid muscles, there is a conus elasticus. It is the conus elasticus. It is called the cricovocal membrane. It is also called the cricovocal membranes. So anteriorly, the thyroid cartilage, both the lamina which is meet into the thyroid angle and it makes the Adam apples. It is the most prominent part of the thyroid cartilage, or it is called the most prominent part of the larynx. The posteriorly, the border, it gives the insertion of the three muscles above to downwards. This is the posterior border of the thyroid cartilage, and it gives the insertion of the palatopharyngeus, salpingopharyngeus and stylopharyngeus muscles. So these are the four borders. This is the upper border which is attached to the thyroid membrane. The lower border, externally there is a cricothyroid muscles and internally there is a conus elasticus. It is also called the cricovocal membranes. Anteriorly there is a two lamina which is meet into the on each side, and it makes the Adam's apple. Outer surface of the thyroid cartilage, it gives the attachment of the three muscles from the sternum to the thyroid. It is the most lower. It is the insertion of the blue color. It is the sternothyroid, and above red it is the thyroid muscles, and the lower one it is the thyropharyngeus part of the inferior constrictor which is arise from the thyroid cartilage. So the oblique line on the thyroid cartilage on the outer side, it gives the attachment of the three muscles, sternothyroid, thyroid, and there is a thyropharyngeus part of the inferior constrictor muscles. Posterior surface of the thyroid cartilage, into the midline there is a above to downwards there is a attachment of the thyroepiglottic ligaments. Just below to it there is a on each sides at the thyroid angle of the thyroid cartilage there is a vestibular ligament, and below there is a vocal ligaments. Just lateral to the vocal ligament on each sides there is a attachment of the medial to lateral vocalis muscles, thyroepiglottic, thyroarachnoid muscles, and the most laterally here there is a thyroepiglottic muscles. So these are the three muscles which is attached. Here it is not seen, but it is also attachment of the thyroepiglottic muscles lateral to the thyroarachnoid muscles. So these are the attachment on the thyroid cartilage. This is the cricoid cartilage. It is the posteriorly it is broad and anteriorly it is the narrow. So this is the posterior part of the cricoid cartilage. It is completely encircled to the larynx. It is the only cartilage which is completely encircled to the larynx, and it is the foundation stone of the larynx. So it is a cricoid cartilage, and the anterior arch which is narrow of the cricoid cartilage. Here there is a, this is the anterior arch of the cricoid cartilage. It is very narrow, and internally it gives the attachment of the cricovocal membrane, and the most upper part of the cricovocal membrane there is a thickening, and it makes the vocal fold, and it contains the vocal ligament as well as the vocalis muscles. So and the externally the this cricoid cartilage, here there is it gives the attachment of the lateral cricoarachnoid muscles. This is a muscles, it is the lateral cricoarachnoid muscles which is attached on the lateral side. It is the lateral cricoarachnoid muscles. Posteriorly there is a cricoid cartilage into the midline, and it makes the prominent reeds, and it makes the attachment of the posteriorly prominent reeds, and it gives the attachment of the posteriorly the median ridge, it gives the attachment of the esophageal ligament. If it is lies here complete, so esophageal ligament, and on each side there is a groove on the cricoid cartilage, it gives the attachment of the posterior cricoarachnoid muscles. So this is the posterior cricoarachnoid muscles. It is the also called the safety muscles of the larynx. It is the chief abductor of the vocal cord. It is we have removed the mucous membrane, and here you can see this is the posterior cricoarachnoid muscles, and this one is the my forceps which is under beneath. It is the lateral cricoarachnoid muscles. It is the adductor muscles, while the posterior cricoarachnoid, it is the abductor muscles. And here you can see these are the transversely fibers which is goes, it is called the transverse arachnoid. So the transverse arachnoid and another muscles I will show you. Here you can see the fiber which is goes transversely. This is the muscles which is goes transversely, fiber which is goes transversely, it is called the transverse arachnoid, and this is the muscles which is goes obliquely, and one base of the one arachnoid cartilage to the apex of the another arachnoid cartilage, and it becomes continuous as a area epiglottic muscles inside the area epiglottic fold. So this is the oblique fiber. This oblique fiber, it is the fiber of the oblique interarachnoid muscles, and this is the transverse arachnoid muscles, the fiber which is goes transversely. So this is the transverse fiber, it is called the transverse arachnoid. Transverse arachnoid and lateral cricoarachnoid, these are the two muscles are the adductor muscles, while the posterior cricoarachnoid, it is the chief abductor of the vocal folds. This is the anterior view of the larynx, and this is the thyroid cartilage, and this is the cricoid cartilage. Anterior lamina of the cricoid cartilage has a superior border and inferior border. Superior border on the outer side, it gives the attachment of the lateral cricoarachnoid muscles which is inside the cricothyroid muscles. This is the cricothyroid. Just inside there is a cricoarachnoid muscles. Here you can see this is a lateral cricoarachnoid muscles, and internally this cricoid cartilage anterior arch, it gives the cricovocal membrane. This is a cricovocal membrane, and it is also called the anterior part, it is called the conus elasticus, and the upper part, it is the free, and it is make the vocal cord. It makes the vocal cord. It is the contains the vocalis vocal ligament as well as vocalis muscles. Here you can see this is the cricoid cartilage. On the posterior lamina, on the base, there is a convex, and it gives the attachment of the arachnoid cartilage. Now we will discuss about the arachnoid cartilage. Arachnoid cartilage, it is the pyramidal in shape, and it present this is the apex. It has a base which is concave, and it is attached to the posterior lamina of the convexity of the cricoid cartilage, anterior lamina which is thin of the cricoid cartilage, and posterior lamina which is broad. It has a three surface. One is the posterior surface. Here you can see this is the medial surface. This one is the medial surface which is facing inside the laryngeal cavity. Anterolateral surface which is facing on the lateral side. This is the anterolateral surface. This one is the anterolateral surface, and one is the posterior surface. It has a two process, muscular process and vocal process. This is the outer, and laterally there is a muscular process, and inner it is called the vocal process. So the base of the arachnoid cartilage, it is concave and it is articulated with the upper border of the lamina of the cricoid cartilage, posterior lamina of the cricoid cartilage, and it is the apex is curved by the posteromedially and articulated with the corniculate cartilage. Here there is a corniculate cartilage, and above to it there is a cuneiform cartilage inside the ariepiglottic fold. So these are the two cartilage, corniculate, and this is the cuneiform. Corniculate, it is the bean shape, rounded, and it is the cuneiform, it is the rod shaped cartilage. So these are the arachnoid, corniculate and cuneiform cartilage, which is the paired cartilage, while the epiglottis, thyroid and cricoid cartilage are the unpaired cartilage. So this is about to the cartilage of the larynx. Laryngeal joints. This is the thyroid cartilage and this is a cricoid cartilage. Posterior, there is an inferior horn of the thyroid cartilage which is articulated posteriorly with the cricoid cartilage, and it makes the cricothyroid joint. It is the synovial joint, permit the rotatory movements around to the transverse axis. This is the one side, and it is the opposite side. You have to draw the axis transversely, and it lead to it permit the relaxation and tension of the vocal cord. So it is the cricothyroid joint which is passes on the both the side. It is working into the transverse axis. Another, it is the joint. It is the arachnoid cartilage over the cricoid cartilage. It is the vertical axis. So it is the work into the rotatory moments. It is called the synovial joint, and it permit the rotatory moments around to the vertical axis and permitting adduction and abduction of the vocal cord. So this is the between the cricoid and arachnoid. It is working into the rotatory moments. It is work into the vertical axis. Extrinsic ligament and membranes. Here you can see these are the extrinsic ligament and membrane are outside the laryngeal cavity, and it is the fibroelastic tissue of the laryngeal cavity. The thyroid membrane, here you can see this is the hyoid bone and this is the thyroid cartilage. In between this is the thyroid membrane, and we already discussed it is pierced by the interlaryngeal nerve and superior laryngeal artery. Another is the cricotracheal ligaments. It is the first tracheal ring, and between the lower border of the cricoid cartilage it is the cricotracheal ligament. The thyroepiglottic ligaments, here you can see this is the thyroepiglottic ligament, this is the thyroid cartilage and epiglottis. On the apex of the epiglottis, which is attached to the thyroid lamina posteriorly by the thyroepiglottic ligament. Hyoepiglottic ligament, hyoid bone to the epiglottis, it is called the hyoepiglottic ligaments. And cricothyroid ligament, it is the most anterior part of the cricovocal membrane. This is the upper part of the cricovocal membrane. It makes the vocal ligament, while the anterior part of the cricovocal membrane, it makes the cricothyroid ligaments, and it is also called the conus elasticus. The intrinsic ligament and membrane, which is lies inside the laryngeal cavity, and it is a one is the quadrangular in shape. It is called the quadrate membrane, or it is also called the cricoarachnoid membrane. So cricoarachnoid fold. So quadrate membrane, and the most lower part of the cricoarachnoid fold, it is makes the vestibular ligaments. It makes the vestibular ligaments, while the vocal ligaments, from the cricoid cartilage to the upper sides, there is a fold inside the laryngeal cavity. It makes the most upper part of the cricovocal membrane. It makes the vocal ligaments, and it is the narrowest part of the larynx. And there is a two ligaments. The lower fiber of the quadrate membrane, it is called the vestibular ligament, and the upper fiber of the cricovocal membrane, it is called the vocal ligaments. Extrinsic muscles of the larynx, it is a palatopharyngeus, salpingopharyngeus and stylopharyngeus, which is attached on the posterior lamina or posterior border of the thyroid cartilage. Another is the external extrinsic muscle are the thyrohyoid. Here there is a attachment of the thyrohyoid and sternothyroid muscles, as well as the cricothyroid muscles are the extrinsic muscles of the larynx. All these extrinsic muscles which is elevate the larynx except the sternothyroid, which depress the larynx. Intrinsic muscles of the larynx, one is the, here you can see this is the fiber, this is the arachnoid cartilage, and this is the cricoid cartilage, and the fiber which is goes obliquely from the base of the one arachnoid cartilage to the opposite side of the apex of the opposite side of the arachnoid cartilage. This fiber which is the goes obliquely, it is called the oblique arachnoid muscles. The muscles which is goes transversely behind to the arachnoid cartilage on the both the sides, it is called the transverse arachnoid muscles. This is the transverse arachnoid, this is the oblique arachnoid, and there is a ariepiglottic muscles. This is the arachnoid cartilage and this is the epiglottis, and inside the ariepiglottic fold there is a muscles fiber. These are the muscles fiber, it is the ariepiglottic muscles, and just behind to these ariepiglottic muscles there is a fiber which is spread, and this fiber of the muscles which is called the thyroepiglottic muscles. This is the muscles fiber, it is called the thyroepiglottic muscles fibers, and just below to the thyroepiglottis there is a thyroarachnoid muscles. This is the middle part, it is the thyroarachnoid muscles. This is the above part, it is the thyroepiglottic muscles. Middle part, it is called the thyroarachnoid muscles, and the lower part, it is the lateral cricoarachnoid muscles. This is the lateral cricoarachnoid muscles, and posteriorly it is the posterior cricoarachnoid muscles. So these are the muscles which are the intrinsic muscles of the larynx. Muscles which is mainly abductor, it is the posterior cricoarachnoid, it is the abductor, while the lateral cricoarachnoid, this is the lateral cricoarachnoid, and transverse cricoarachnoid are the adductor of the vocal cord. This is the anterior side of the larynx. Between the thyroid cartilage and cricoid cartilage there is a muscles, it is the cricothyroid muscles, and internally there is a this is the fold between the two vocal ligament and muscles. It is a vocal it is called the rima glottidis, and so this vocalis muscles and cricothyroid muscles both have actions to tense the vocal cord, while the thyroarachnoid muscles, it is the this is the muscles which is the thyroarachnoid muscles which is the relax the vocal cord, So this is the thyroarachnoid muscles. Now we will discuss about the laryngeal inlet, outlet, and laryngeal cavity. The laryngeal inlet, which is formed by the anteriorly by the epiglottis, on each side by the ariepiglottic fold, and posterior by the arachnoid cartilage, interarachnoid muscles. So this is the laryngeal inlet, and the laryngeal outlet, which is formed by the lower border of the cricoid cartilage, it becomes continuous as a tracheal ring. So it is the laryngeal outlet, and the laryngeal cavity is divided into the three parts by the supraglottic or it is called the glottic and infraglottic part. So supraglottic part, this is called the above to the two vocal vestibular fold. This is the fold most lower part of the quadrate membrane or ariepiglottic fold. It is the vestibular fold, and the space between two vestibular fold, if you can see from the two vestibular fold, it is called the rima vestibuli, and the space between the two vocal fold, it is called the rima glottidis. So the space between the two vocal fold, it is called the rima glottidis, and space between the two vestibular fold, it is called the rima vestibuli, and the lower part, it is called the infraglottic parts. So the supraglottic part, which is the sensory nerve supply by the internal laryngeal nerve, and the infraglottic part, the sensory nerve supply by the recurrent laryngeal part. All the muscles of the larynx which is supplied by the recurrent laryngeal nerve, except these cricothyroid muscles which is supplied by the external laryngeal nerve. It is supplied by the external laryngeal nerve. Rima vestibuli, it is the space between the right and left vestibular fold. The space between the right and left vestibular fold. It is also called the false chord, and function of this rima vestibuli, it is called the exit valve. It permits the air entry into the inspiration and prevent the air exit in expiration. So it is mainly for the holding the breath. It is a rima vestibuli. And the rima glottidis, it is the space between the two vocal fold. It is called the rima glottidis. It is the narrowest space of the laryngeal cavity. In front, it is bounded by the angle of the thyroid cartilage. Thyroid cartilage. Behind it is bounded by the interarachnoid fold of the mucous membrane. This is the arachnoid cartilage. On the both sides, the interarachnoid fold which is mounted posteriorly. So inner side of the interarachnoid fold. And on each side it is bounded by the vocal fold. This is the vocal fold on the both the sides. So both the side this is a vocal fold. So it is the boundary of the rima glottidis. It has a two part. Anterior part, it is called the intramembranous part. Anterior 2/3 part, it is called the intramembranous part, and posterior 1/3 part of the vocal fold, it is called the intercartilageous part. So between the two vocal process of the arachnoid cartilage, it is called the intercartilageous part, and between the anterior 2/3 part, it is the intramembranous part between the two vocal cord. So it is a rima glottidis. It is also called the entry valve. It is act as a phonation. By the vibrations of the vocal cord, it produces the sounds inside the larynx. So the vocal fold, it is the generate the sounds. Shape of the rima glottidis in quiet breathing, it is the pentagonal in shape. It is inside the quiet breathing. During the high pitch sounds, the rima glottidis reduce the it is adducted and it is a linear chink shape, and during the full inspirations, the glottis which is widen and become the diamond shape due to the abductions of the vocal cord. It is during the full inspirations, and during the whispering there is an anterior part which is adducted, but the intracartilageous part which is widen, and it is during the whispering part, and it is an inverted funnel shape of the rima glottidis inside the during the whispering. The mechanism of the speech you can actually learn inside the physiology, but we have divided into the 4 steps. Expired air from the lungs, it is lead to there is a loudness and intensity, and this expired air, it lead to there is a vibrations of the vocal cord, and this vibration of this vocal cord, it lead to there is a pitch, and it makes the vowels. It is called the swar inside the Gujarati, and after that the resonate, it lead to there is a quality of the sounds which is it is called the in Gujarati it is called the padgo. So the sound which is resonant, it alter by the surrounding the pharynx and nasopharynx, soft palate, all this structure which resonate the sounds, and then articulator, it is the consonant, and the consonant produced by the lips are the pa, pha, ba, pha, and the labiodental lips and dental in between, so it makes the ta, tha, da, dha, na, and the lingual it forms the cha, ja, ja, and palatal it makes the ka, ka, ga, and ga. So this is about to the production of the voice. Arterial supply of the larynx by the superior laryngeal artery. It is a branch of the superior thyroid artery, and below by the vocal cord by the inferior laryngeal artery. It is the branch of the inferior thyroid artery. So blood supply of the larynx and the venous drainage by the superior laryngeal vein, it drain into the superior thyroid vein, and inferior laryngeal vein drain into the inferior thyroid veins. Lymphatic drainage above to the vocal cord, it is inside the prelaryngeal and jugular-digastric lymph nodes, and the below to the vocal cord, it is drained into the pretracheal and paratracheal lymph node. Clinical aspect of the larynx, inflammation of the larynx, it is called the laryngitis. The Singer nodules, misuse of the vocal cord or frequent use of the vocal cord. The person who are using more talk throughout the day, like professor or person who are more talkative, have a lead to there is a produce the nodule at the vocal cord, mostly at the junction of the anterior 1/3 and posterior 2/3 of the vocal cord. It forms the Singer nodules. Pyriform fossa, just lateral to the area epiglottic fold. Here you can see this is the area epiglottic fold, and lateral to area epiglottic fold, this is called the pyriform fossa. Previously, the smuggler can put the diamond in here and smuggling the diamonds, so that's why it is also called the pyriform fossa. It is also called the smuggler fossa. Posterior arachnoid, it is also called the safety muscles of the larynx, which if paralysis of this muscle, it lead to there is a both the sides, which is paralysis of the posterior arachnoid. It lead to there is a which abduct the paralysis of the abduction of the vocal cord allow, and there is a no air which is enter inside the trachea or inside the lungs, and it lead to there is a breathlessness, and ultimately the person can be died if there is a paralysis of the both side of the posterior cricoarachnoid. So that's why it is called the safety muscles of the larynx. Damage to the external laryngeal nerve, which is pierced to the cricothyroid muscles, and if it is damage to the external laryngeal nerve, it lead to there is a damage to the cricothyroid muscles, and weakness of the phonation due to the loss of the tightening of the vocal cord, because the cricothyroid, which is the main muscle for the tone of the vocal cord. So external laryngeal, which supplies to the cricothyroid, and paralysis of the cricothyroid lead to the sound weakness of the phonations. So this is about the clinical aspect of the larynx. Hope you enjoy the lecture. Thank you very much.